Okay. Critical care medicine. ICU acquired weakness and recovery from critical illness. Definition is that critical illness polyneuropathy affects the limbs in a symmetric pattern. Weakness is most notable in proximal neuromuscular areas, like the shoulders and hip girdle. So the application medicine is that ICU-acquired weakness with documented polyneuropathy, myopathy, or both can be subclassified. Critical illness polyneuropathy refers to ICU-acquired weakness with electrophysiological evidence of an axonal polyneuropathy. Here's a video to explain.
Tell my regular that or a traumatic event going through being in the ICU really needs to be treated from a holistic perspective.
Okay, so what she means is that these kind of patients need to be addressed as a whole patient. I mean, they need to be treated their physical injuries, their mental injuries, and also their feelings are very important. So the pros of this are the survival among patients in the ICU has improved dramatically over the 20 years. Indeed, the observation that extremely ill patients often survive the illnesses have led to a relatively new focus of clinical investigation on patients who survive critical illness. Okay, the cons are rehabilitation after critical illness is arduous and often frustratingly slow, so particularly in elderly patients. The greatest burdens that survivors of critical illness face are related to neuromuscular dysfunction and neurophysiological maladjustments. Here is another video.
To improve the process for ICU, I think changing the policy on admission hours for family to be with their patient.
So, really, in what could change in the well, they're in the ICU, they could have their family more often, and so because they really need someone to talk to, and they need the strong support system, as I said before. So diseases associated with this disease are functional disability, a natural consequence of weakness, is a frequent and long-lasting complication in survivors of critical illness. Also, muscle weakness and functional impairment were frequently observed at 1 year, and recovery from physical dysfunction was incomplete even 5 years after discharge.
I think it's important for regular doctors to learn a lot about sepsis. No one is really taking ownership of this problem. The ICU people deal with this all the time. I think the general practitioners don't see this enough. I think it would be wise from a referral point of view that the critical care doctors would actually educate the primary doctors so that the referral goes back and forth and the patient gets the biggest benefit.
So the recommendation here is that these doctors take more knowledge of the sepsis, and they can be more careful about these complications. So finally, we have the conclusion that says, although some of the risk factors, such as sepsis, cannot necessarily be prevented, aggressive treatment of such conditions is nevertheless important to minimize subsequent morbidity. So it is very important that people around the patients know how to deal with these kind of situations like sepsis. And finally, here's the last video.
With other survivors. Maybe through email or internet or any kind of survivor group, trauma group, pain group that you could find. Because no one truly understands what you're going through. And it's really difficult, especially if your family and friends try to understand. They just can't. You just haven't. And I had days where I felt like I was crazy or my thoughts and feelings were just not normal. And
Thank you.